more from recording in progress, from the displacement background. And it's really from that that I've recognized more and more the need for this type of work to be done. How are we countering and kind of disasters? So I will start. Today I have the great pleasure to, sorry, this is always the most awkward part of presentations. Here we go. To discuss some research that I was part of on anticipatory humanitarian action from the Red Cross, Red Crescent movement. So our research really started from the question, what happens when you're planning for a disaster and another disaster strikes? So we looked at 14 Red Cross, Red Crescent national societies and how they were trying to adapt what were called early action protocols. So really the paper plans for anticipatory action. And we looked at kind of a variety of different elements of these protocols to understand how COVID-19 had impacted them. And I'd say this is really important because, as Stephanie mentioned, there were a number of different extreme weather events and disasters that happened during 2020 that affected over 51.6 million people. And so someone once said to me in an interview, COVID's not just it's not just a crisis, a disaster, it's a context. And I think that's a really useful framing for the lives we've all been leading, right, these past 15 months. So we found that 10 out of the 14 societies that we spoke with did modify their plans, but often this was informal rather than formal for a variety of reasons that I'll discuss. So to start with, just a brief example from Bangladesh, which we'll also get the chance to hear more about later today. So Bangladesh had in their early action protocol, so on paper with the funding tied to that the plan was, in the case of a cyclone, which was indeed activated in May, that they were going to assist people with evacuation. They were going to provide first aid at evacuation sites and shelter, distribute food, provide artificial light at shelters. And obviously plans had to be modified. Oh, excuse me, sorry. So just as examples of some of the changes is beyond just the basic face masks and so on, that there was really delayed evacuation. And in order to minimize crowding, which on one hand is a great kind of safety protocol, but also demonstrates kind of with multi-hazard some of the risks that can occur through making changes. And I'd add to that, one of the risks is also thinking about people themselves, that behaviors change. So there's some interesting research talking about, people that are interested in going to a shelter for the very obvious reasons of being scared, and how is that being adapted or not adapted and taken into account from organizations working to assist people. So there was also kind of the extra labor involved of disinfecting shelters, trying to take COVID-19 precautions, but also kind of getting the job done. And so while there was some submissions for formal changes to the plan, kind of through the normal Red Cross, Red Crescent channels, it was really hard to get that funding in place. And this was something we heard across a number of different societies, that the bureaucracy involved in getting extra funding released that wasn't planned for is often really hard, which led to more informal or different channels for getting funding. So in this case, in Bangladesh, there was the opportunity to receive funding from the IFRC country office instead of through that formal channel, which is called FBA by the DREF. And then the impact of COVID-19 had a huge effect on the internal resource capacity. So I'll go on to give a few more examples, but more time, more people were needed for activities that generally could have happened faster. And as a result, more funding was needed, which wasn't necessarily provided in all of the cases we looked at. So as a sort of brief takeaway at the beginning, we found that there's a clear need for hazard and procedural guidelines in place, flexible funding mechanisms, resources and capacity building, and increased localization. And it was really when some of these or all of these were happening that there were the most successful adaptations to the plans that were then able to be implemented despite COVID-19. So I'll briefly go over these. So we found that often national societies had the guidelines available about COVID-19, from the World Health Organizations, often from national governments, they aligned mostly with those guidelines. So the challenge was more in this internal procedures for modifying formal plans. So how do you go through the formal channels? There wasn't always that clarity because there hadn't been this multi-hazard risk assessment really taken into account. So most anticipatory action has really only focused on one hazard at a time. For reasons that, it's hard to sort of take a uniform approach to analyzing different hazards. It's actually a kind of newer area of research and really, really important, clearly. So as one sort of next step, that there's a real need to provide a basic understanding of operational challenges that different hazards present. So, if there's floods, that might affect road access. So then if you're trying to, get access to people in order to address something else, how do you take that into account and plan in advance? And because of the challenge of doing this kind of research and analysis in advance, which I'd say is very, very important and is being worked on. But we thought, well, at the very least, something that organizations identified as important was just having kind of an understanding of different hazards that were possible and simulations that could happen, or at the very least discussions in advance to say, if this is what we're dealing with, how can we address it and continue as planned? But all of this requires money. So definitely flexible funding was something that came up as really important. So for example, in Ecuador, contrary to what was planned, distributions were outdoors for in-kind goods. There was a need for social distancing and small groups. And because some of the people that were being assisted were kind of indigenous and needed additional translation, more people were required to kind of define concepts such as COVID-19 and disasters in advance. So again, more staff, more time needed. In Mozambique, there was an example of some really nice dialogue that took place, that although the trigger for wind speed was meant to be at 120 kilometers, there was discussion around, because of the increased vulnerability economically that people were facing due to COVID-19, could it make sense and to have that activation happen at a lower threshold, which did indeed happen. And then there were some really unfortunate situations where, in the case of extreme heat in Vietnam, the cooling buses were canceled, and instead there were efforts to have ventilation in cooling tents that was, more improved, social distancing and so on, but that brought on additional challenges. So this all comes down to resources and capacity building, which is a phrase I'm sure we all think is important and hear all the time as well. But there was a real kind of clarity from different societies around just COVID brought on competing priorities in the face of competing priorities, right? And that already there's, I'd say, it can be a challenge to address anticipatory action in general. I'm sure that's something some of you have experienced as well, to sort of define that as important before something has happened. So stretched resources. There was an example from Kenya of someone that was trying to get clarity on how to get additional funding to modify the plan for activation. And someone said to them, is this related to locusts? If not, come back next week. That was the hazard and the priority that had to be competed with. So this also brought an interesting discussion on that was kind of with my co-research. It was really interesting for us to think about what does surge capacity look like in an anticipation context. So we really identified, based on what people themselves were identifying, this need for additional, not just the funding, but additional people. So more volunteers that in some contexts weren't available because people were scared because of COVID-19. So whereas generally there had been an opportunity to use a larger pool of volunteers, that wasn't the case. So how do you mobilize, in particular within really short time periods? And that might be something different than in some other contexts. Could that happen through kind of a national pool of people ready, international, maybe a combination? So these are questions that we kind of raise through the research. And definitely, I'd say increased localization. So this idea of how are you transferring not just funds, but responsibility to different levels, and not just the national, but really going down to the local. And there were some really exciting examples of national societies saying, we got to do it ourselves. And actually, in some instances, there had been really useful past training. So even GIS mapping training that had that supported different activations. And this also goes into different areas. So COVID-19 brought on global supply chain delays, and that had effects in different for different societies and obviously different organizations and actions around the world. So local procurement is an important example of localization. And there was also some interesting examples of stakeholder consultations and beneficiary consultations that were able to happen despite COVID-19 because there had been information collected in advance, because there was a hotline in place to get remote feedback. And so some of that advanced thinking means that even if people can't physically be reached, that there's an opportunity to continue to have people be part of the conversation in important ways. So I think as a question that's really important for us to think about are what are the elements that can be turned over to the local level now, and really why wait for this? And I think this is part of a bigger conversation that I'm really excited is happening within the humanitarian system on localization and kind of recognizing the barriers that maybe don't need to be in place to make changes. And COVID-19 in some ways showed us what's possible because people weren't traveling the way they normally would, and a lot of responsibility was passed on. So in summary, there's a real need to clarify both the funding and the kind of protocol modification procedures, at least within the Red Crescent, FBF forecasting movement. But I'd say that that might be the case beyond as well. And definitely a wider need to think about critical disruptions caused by various hazards and how they overlap and how to plan for them accordingly. There's a need to enable flexibility in protocols and funding. So something that some people brought up was, could there just be a flexible funding pot from the beginning? And we do have some really good examples of that exist, but aren't necessarily streamlined into some of these procedures. And a need to adapt surge capacity in some form, again, open to kind of questioning and thinking more about to anticipation. And again, just going back to localization, we need to devolve power and decision-making and resources to the most local level. So I will end that here, if I can figure out how to move to the last slide. Thank you very much. And on behalf of the researchers, it was wonderful, other researchers, it was wonderful to share this with you, and happy to answer any questions. And Stephanie can also answer more of the technical questions around the anticipation hub and so on. Thank you.
Thank you, Evan. That was fascinating, and a virtual applause for you. I thought it was really interesting what you were saying about sort of informal and indirect kind of connections and mobilizing. So perhaps that's something I'd like to ask a question about later. Please do put questions in the chat that we'll come back to. But we'll now move on to our second speaker, who is also connected to the German Red Cross and the Anticipation Hub, and that is Sheikh Karul Rahman, who works with the German Red Cross as a project delegate for forecast-based financing in Bangladesh. Sheikh has over 13 years of experience in the field of humanitarian work in India, Nepal, Bangladesh, Myanmar, Sri Lanka, Thailand. And currently he's supporting the host National Society to develop and strengthen forecast-based financing for cyclones, floods, and heat waves. So Sheikh, over to you.
Thank you very much. Hi, hello everyone, and welcome. Thank you for taking out time and joining us today. So I'll be talking around anticipatory action in the time of COVID-19 and what are the challenges we face and how we can actually overcome those or minimize those and work during COVID-19. So as you know, the COVID-19 has posed a number of challenges, number of questions to us to perform the humanitarian actions that we do. For anticipatory actions, the questions that we are facing are, how do we implement the early actions in the time of nationwide strict lockdown? There is restrictions on the movement, physical gathering, and conducting activities. And evacuation is another key component of our early action. So we evacuate hundreds of people to the safe shelter. How do we accommodate them in the safe shelter, maintaining the physical distance and all other measures? Then how do we ensure that they are safe while they are at the safe shelter? On the other hand, we have duty of care towards our staff, towards our volunteers, and versus the operational and field needs, because there is needs on the ground and we need to act. So how do we balance that? And also, you know, there is in the supply chain, in the production, in the imports, there is disturbances. So how do we ensure the goods and services are there to continue our operations? So these are the questions, and I'll try to answer a few of them, I guess, through the examples of the work, the actual work that we did here in Bangladesh. You know, since last 1.5 years, there has been 3 extreme weather events. The cyclone, Amphan cyclone, then 2020 floods, and very recently this year, there were heat waves also. And we acted during all those 3 key events, and we were able to reach out to 56,000 people, how we did that, what are the strategies we took. So these are the 4 key strategies that we very recently developed, like in 2020, while we were implementing the heatwave anticipatory action, the pilot that we are doing in Dhaka. We developed an integrated multi-scenario based plan. So 2 scenarios: if there is lockdown, strict lockdown, how do we implement our anticipatory actions? If there is no lockdown, how do we implement that? So there are 2 different sets of scenario, and then 2 different sets of early actions also. And then those actions were actually were such which could be implemented if there is lockdown or if there is restrictions on physical movement or physical gathering. And of course, while we were planning them and also in our implementation, we ensure that the guidelines, the COVID-19 guidelines from WHO, public health authorities, and IFRC, those are there and those were ensured. These are the few actions that we took to ensure that we are operational, we can function during COVID-19, as well as the people with whom we are working, they are safe. Our volunteers, our staff, they are safe. So we oriented the volunteers, the staff members, CPP volunteer members on COVID-19 so that they know what to do and how to operate during this COVID-19 time. We provided them adequate safety materials such as mask, hand sanitizer, hand gloves, PPE kit, so that they can protect themselves while they are on field. In terms of protecting the beneficiaries, we also allocated additional budget so that we can distribute masks, sanitizer, then soaps to them for additional layers of protection. Before using any shelter or any distribution point like cash distribution point, we ensure that those places are disinfected so that they are safe to use. And also in terms of physical distancing at the shelter, at distribution point, we try to maintain that. You can see here in this picture, in this image here, at the distribution point, we were really able to maintain that, but at shelter, it was really challenging for us. But we tried as much as we can to maintain the physical distancing. And also we ensured that our early messaging, early warnings, all those includes COVID-19 messaging also. And we displayed facestones, we distributed leaflets, and very recently, we also did miking in Dhaka while we were implementing the heatwave early actions. And of course, while doing all these activities, we were closely coordinating, closely communicating with the local administration, particularly the health department, so that they know what we are doing, as well as they can guide us. They can help us to implement all these actions, maintaining the COVID-19 protocols. And of course, coordination and communication, it is important. And again, because of COVID-19, it was affected. So what we did, our approach was converting them more virtual rather than having more physical meetings. There were physical meetings, few physical meetings with limited numbers of participants because there are few members who can't be reached through the virtual approach. And also there are few activities like communication activities with the community. We converted them in such activities that does not really need people to come together, like miking or giving out leaflets, so that we can give the messages while we are not calling people together. As you know, cash and voucher assistance, it's one of the key important component of early actions. And now I think it's really important than ever before. So because of COVID-19, that was also challenged, how we acted during that time, during this COVID-19 time, and implemented our cash component. There are 3 areas. These are the 3 areas where actually we focused and we were able to very smoothly, I can say, to implement the cash component. So we ensure that our approach, the way we work, it does not really expose the vulnerable families with whom we are working to COVID-19. So we are not really calling people to receive the cash from some distribution point. We changed our approach. Earlier, we were calling them at a distribution point and giving the cash. And very recently, the heatwave early actions that we implemented in Dhaka, we did that through MMT, mobile money transfer. And also, you all know, right, that the service provider, the financial service provider, they are also working in limited capacity, in reduced number of hours, reduced number of staff. So how do we ensure that the speed and the efficiency of the transfer we are doing, it's there? And how do we meet the lead time? As you know, in anticipatory action, the lead time is one of the key components. We need to implement all the early actions within that lead time. That might be few hours, that might be few days. And for flood, it was only 5 days for us. And for heat wave also, it was 5 days. So we need to transfer the cash as soon as we can, so that people also get some time to use that cash before the actual disaster happens. And then we need to really select the financial service provider, the one that can really work during the COVID-19. And that should be contactless, that should really operational, that should be operational during the pandemic, as well as it should be user-friendly. We should not really use any financial service provider about which the beneficiary, they don't know anything. So as I mentioned, very recently for our heat wave early actions, from the distribution point, the physical distribution to we transferred ourselves to MMT, mobile money transfer. These are the key way forwards I would like to mention here. The scenario-based planning that I was talking about, it was really very useful for us because we didn't really know what is going to happen in future in a couple of weeks. So we developed 2 scenarios, and we were sure that either of the scenario will be there, and there are also sets of actions that we predefined. So one of the scenario we selected, and then we implemented the early actions. Since 2020, as you know, this COVID-19, this pandemic, it's so fluid, so changing, it's so dynamic. So us, the humanitarian community, the anticipatory actors, we need to be very adaptive to the changing situation to be able to implement the early action during this challenging time. And you know, while we, as I talked earlier also, we have been evacuating hundreds of people to the safe shelter. And as you know, there is overcrowding in the safe shelter. And COVID-19 was there. So how do we manage that? The overcrowding is not there, and we are really able to contain the spread of the virus, or at least minimize that. So augmented safe shelter strategy was there. We really consider the informal shelters that is there in the community, like any community buildings or maybe warehouse or schools, we consider them. And we were really able to reduce the overcrowding at the safe shelters. And at the same time, we acted at 2 levels, at shelter level as well as also at the individual level, so that we can reduce the vulnerability of the people to get infected by the virus. On the other hand, for making our volunteers, our staff safe, we acted at these 3 areas: building capacity or orienting them how they can work to protect themselves while they are in field. That was one of the area. The second area was we provided them adequate materials so that they can use them while they are going to the field and working in the field. Insurance is another component, though we were not able to provide to all the volunteers, but we covered many of them, so that if any incidents happens, like if any of the volunteers get infected by the virus, the insurance can take care of the expenditures that might come because of the treatment or any other expenditure. And again, you know, pre-stocking we do, but I think this time during this COVID-19, it's more important. If we have pre-stock, we can really very quickly move that to the field and distribute. Having framework agreement with the vendors, that is also important, and we are also trying to consider that, focusing more on that, so that very quickly we can move them and they can provide us or supply us the goods and services that we need to implement the early actions. Decentralization, I think the previous speaker, even she was also talking about this. So we have decentralized teams who can implement, who are trained to implement the early actions. We have at the community level volunteers, then at the district level, then regional level, and then at the national level. So very quickly we can mobilize them, we can deploy them to implement the early actions. Decentralized fund, another area which is really helpful to implement the early actions. So particularly for the cyclone zone, at the district level, there is decentralized fund, and those funds could be very quickly utilized as soon as the trigger is hit, the EAP is activated, they can start working. they don't really need to wait for the fund to be transferred from the national headquarters. Then the operational decentralization that is also needed, so that the people who are working actually on the ground at the district level, they don't really need to wait for the decisions, the operational support from the national headquarters. Some of them could be transferred to the district level so that they can take care of their own. That's all. Thank you so much for hearing me. I'll stop there. Thank you.
Thank you, Shok, and virtual applause again. And really interesting to see lots of examples from on the ground in a kind of applied sense there. And again, the issue of sort of localization and decentralization coming up. So that I think that will be something we return to in the Q&A. So our final speaker is Dr. Mark Quigley, who is Associate Professor of Geological Hazards in the School of Earth Sciences at the University of Melbourne. So kind of moving to more of a kind of geoscience thinking, the connection between multi-hazards and COVID now. So in addition to authoring over 100 publications on tectonics, climate change, landscape and multi-hazards, Mark's a keen science communicator and has received a number of awards for his work in science communication. And most recently, he's been publishing on the link between multi-hazards and natural hazards and COVID-19. So Mark, I'll hand over to you.
Thanks very much, Faith, and thanks everybody for organising this important event. I'm actually very privileged and honoured to be invited to be able to share some of our work with you. I'm under the presumption I was asked here because we published some recent research on this topic, and including one of the first papers in the world in May 2020, where we looked at trying to model the effects that concurrent crises, natural hazards and disasters might have on COVID dynamics and so on. And since then, we've focused on more specific examples, Timor-Leste, where we have an ongoing research program. And I'd just like to acknowledge my co-authors from the University of Melbourne and from further afield, including Timorese co-authors on some of our work. So thank you very much. On the 4th of April, 2021, there was an extreme rainfall event in Timor-Leste, which is, for those of you who are not familiar with the geography, just at the northwest coast of Australia in the Indonesian Sea region. So there was sustained rainfall, low pressure system building and sustained rainfall over several days, but culminated with a really extreme precipitation event over the island. The low pressure system eventually became tropical cyclone Saroa, which moved down to the southwest. But as a result of that high rainfall event, there were numerous landslides across Timor-Leste. There's a massive flooding in the urban environment, including in the most populated capital city, Dili. There were lots of evacuations into 40 evacuation centers, shown here by some of the pictures. 42 fatalities, 14,000 displaced people, and over US $100 million in estimated damage. Now, this is what we would call a highly foreseeable multi-hazard event with recent historical precedent. So as recent history, 13th March 2020, there was a similar event, 2 fatalities, 9,000 people displaced. And so from that perspective, it's a highly anticipatory hazard. The images I'm showing here are the flood hazard map from Timor-Leste, published in 2007, showing in the blue areas of high flood risk that were recognized. So from that perspective, this most recent flood event was not a surprise. In the top right, showing cyclone tracks from 2000 to 2012. Again, very, very similar to the 2021 event in terms of the track and intensity. And then a map with all those black dots representing individual mapped landslides. In the high topography and weak rocks of Timor-Leste, landslides are a very frequent hazard. So the context is there to both historically and from a science point of view, so that this is a highly anticipated event. And in a lot of places in Timor-Leste, this could be considered to be a tolerable risk. People live on active floodplains and put up with regular flooding all the time. There are a variety of cultural reasons for that. There is communal adaptation to that. In some cases, the way the houses have been designed is to cope with the flooding and so on. But with unmitigated urban growth and deforestation and so on, the risks of flooding are being amplified in a progressive way. We know that from an anticipatory perspective that the meteorological conditions leading up to this most recent event were all there. It's a La Nina year, the MGO, the Madden-Julian Oscillation was in effect, the Western Pacific monsoon season was in place, and we know that the geological and geographical aspects of Timor make it really susceptible to these sorts of events, as well as some of the anthropogenic events I described earlier. And interestingly, a lot of the flood debris from the former event still choked a lot of the urban stream channels and so on. And so this whole issue of the importance of cleaning up after past flood damage to ensure that urban drainage can function as we would like it to is something relevant. However, the key distinction here is that this recent event occurred during an ascendancy in COVID. And so Timor-Leste actually has been held up in a lot of ways as a real strong example of good mitigation against COVID, of a really effective response and so on. But this time series here, on the x-axis we have the date, and then on the y, the number of new cases reported. Beginning in March, COVID started to make an appearance in communal transmission and so on in Timor-Leste, in the capital city of Dili. And there was a rise in COVID cases leading up. So there was a stay-at-home lockdown enforced very early in the piece at very low case numbers. And that was probably quite effective in sustaining a relatively low growth rate. But when the flooding occurred, there was a state of emergency declared. And this was largely because of the flooding effects and the fatalities and so on, but also the need for people to be mobile, to evacuate and to be reached and so on. The state of emergency was lasted until the 1st of June. But on the 9th of April, the stay-at-home orders were formally suspended and people could actually legally move around from a formal point of view, and then reinstated in the 16th of April. So there was a period of time where the very strongly mitigated COVID scenario was relaxed as a result of the response to the flooding and the impacts of the flooding. And so we see in photographs and from some of our Timorese co-authors, their accounts that social distancing, PPE use was compromised during this period. And we do see a rise in the rate of COVID-19 immediately, within a week or so after the stimulus event and ascending long thereafter for at least a month and a half after. The question we would have in this situation is, how do we distinguish this natural progression? How do we distinguish this trend and the possible attribution to a multi-hazard scenario relative to just the natural progression of a restricted COVID-19 outbreak? And it's an important question to ask from an anticipatory point of view, because obviously the more these kind of external stimuli have the opportunity to really challenge responses and create unexpected effects, the more risk amplification occurs. So to do this, we've applied phenomenological modeling of COVID-19 dynamics, and I'll tell you just a little bit about what these things are. So they seek to explain empirical relationships. So for example, how COVID-19 is spreading, but they don't seek to explain specifically why different variables interact with each other the way they do, so government interventions and so on. They're not based on first principles. There's no underlying theory to these models. We only try to mimic what's observed. And they're used and can be effective in highly uncertain parameter space, where we don't really know what's going to happen, but we can try to model it in an anticipatory way. As we get more confidence in the various parameters that might go into epidemiological models, we might seek to make more mechanistic or agent-based models. And I'll show you a little bit about that in a second. So I think all of us in the room will know something now about how COVID-19 spreads in terms of infection rates and cumulative cases and so on. And so we might describe this as kind of an S shape that starts slowly and ascends at a steep rate and then dies off. And so we have a logistic function and way of modeling that very simply. And in example one here on the left, we have a model fit to the empirical data from Wuhan for that first COVID wave. And it just basically shows how we might create a very simple phenomenological model to fit empirical data. The second example here shows how we might create phenomenological models to look at variations in the infection rate, the rate of COVID-19 increases, for a case where there's no intervention, the blue line, versus where we have some mitigative measures in place, which is represented by the red curve. And so the peak of the red curve is lower and it's more delayed because the rate of infection is lower. In a sense, the curve has been flattened because of mitigative procedures. And then the final example, which is relevant to the talk that I'm describing here, is where we say we're in a mitigative scenario where PPE is being used, where there's some restrictions in place, but then there's some sort of natural hazard that occurs, and the mitigative strategies have to be relaxed, and the measures need to be relaxed, and there's a period of time that we might pre-prescribe whereby we're not controlling the epidemic. And so that is represented by the dashed line that ascends upwards and then goes down. And so we see a lag time between the external event, which is the vertical dashed dotted line there, and the rapid onset of COVID-19 infections. And we can model that and change the parameters depending on how we might think that the intervening natural hazard might affect some of those parameters. So let's apply this. So this is a Timor-Leste forecast model. And the cool thing about this model was that we built this basically using data right to the onset of the floods to try to constrain some of the parameters. And so the blue line is real data in terms of confirmed infection cases, daily cases, the rate. And then the yellow dashed line there is the flood event, the big floods that occurred. And we have two scenarios that we modeled. One is that it took 2 weeks before the mitigation measures could be back reinstated, and the red line is 3 weeks before they could be reinstated after that. And so we can see that these are models. We certainly over predict the infectee rates. Perhaps we made assumptions about how much the rates would increase as a result of COVID-19. But they do sort of simulate what the observations turned out to be in a sort of a morphological sense. But then we can go back and say, okay, well, let's now knowing what we know, how might we adjust those parameters to try to improve our models so that they might be applied elsewhere or to other scenarios, other disasters, other areas. And so the modeling that I show here on the right is where we say we have a 5-day time lag until the restrictions can be back enforced. We change the number of total infectees that we think might ultimately become infected by COVID-19 as a result of this progression. And you see the green dashed line there is kind of a model fit to the empirical data. And then we can play around with that from them. So I think what we learned from this is that if we can rapidly produce ensemble models, phenomenological models, at the early onset of an event, we might be able to think about how certain aspects of the response, certain characteristics of the intervening natural hazard might lead to different sort of scenarios going forward in terms of COVID-19 infection and so on. I think one of the most important things, if you take nothing else out of this, is that when we have an intervening natural hazard event during the ascendancy towards peak COVID-19 rates, we can get a very, very big effect. So that's what's represented in the panel on the left, where we have ascending COVID-19 rates, and then we have this big stimuli event, which causes a big peak. If we have that same type of stimulus on the declining part of the COVID-19 infection rate curve, the effects tend to be rather small. and is somewhat comparable to the noise that we might get for a variety of reasons, other words, and that's an important thing. And more sophisticated models recently published come up with very similar types of results. So these are agent-based models. They're more sophisticated than ours. The red lines represent the observed daily infections in thousands for Campania, Italy. And then what the second, third, and fourth panels represent is the occurrence of a volcanic eruption simulated during that COVID-19 natural progression, and how that might affect the infection rates. And so each black line you see, if you get an earth volcanic eruption very early in the curve on day 2, you tend to get an earlier peak because you've had to relax your restrictions and so on. But you don't tend to get a much higher rate of infections overall in terms of peak rate. However, if you get a volcanic eruption in the sort of 25-day or 50-day period when you're at your peak COVID infection rates already, you can get massive effects. And this just schematically represents the kinds of things that are captured by that. So if we don't have a natural disaster, there's going to be infections, and there'll be a variety of parameters that influence that infection rate curve. If you do have a natural disaster prior to or after the peak, you might get a small effect. But if you have one during ascendancy or during the peak, you can expect very large increases. And these findings of these more sophisticated models are consistent with our PMs. The other thing we know, of course, is that hazards tend to create multi-hazard cascades. Hazards interact, and this is just one way of representing that. If we think about a large flooding event that occurs, we know that floods can increase the likelihood of landslides, which is a vertical arrow there represented by LS. Further floods, they can increase the likelihood and probability and severity of a whole bunch of different types of hazards in a sort of positive feedback sense, infrastructure damage and so on. And then the circular arrows here represent feedbacks back into flooding. So for example, if an earthquake occurred in a flood scenario, that earthquake could further amplify the flood hazards and so on. So this is this multi-hazard cascade way of thinking about of multi-hazard cascades in COVID. And so we want to move now into this rather simple question. Why do we not see clear, unambiguous evidence for the influence of concurrent hazards on COVID-19 infection data? And I think it's really important to ask that. So we'll go back to Bangladesh, and I thank the former 2 speakers for their talks on this. Just to reiterate, there was the cyclone Amphan that moved in mid-May into Bangladesh and in West Bengal. And the impacts of this cannot be understated, but there have been various ways of looking at how the track of the cyclone related to population clusters, and actually the track was not a sort of a dead hit on a lot of the biggest built up areas. It was, there was a sense there's some lucky elements of that. People have pointed to, in the bottom panel here, the increase in COVID-19 infection rates after the kind of onset of this cyclone, and suggested that the cyclone basically, because of the measures that needed to be taken, increased the rates of COVID-19 in Bangladesh. And so the questions we might have, though, are how is this proposed influence epidemiological trajectory, represented by the pattern in the graph on the bottom right, distinguished from any sort of natural progression? There are some interesting things here. One could look at this from the perspective of a near miss. Had the track been slightly different, perhaps it would have passed through even more populated areas and increased the exposure to the hazard. Perhaps the anticipatory and mitigative actions that have been described by the previous speakers were quite effective at reducing the rates of spread. And there's the question of how well this data actually reflects the reality of the situation. And these are all good questions to ask that we don't necessarily have answers to. What we do know is if we go to a place like Melbourne and we look at its COVID-19 case rate, this is just our second wave, second of 4 at this stage, the red line representing that, and the blue line represents a mobility score. So in a sense, it's a proxy for how mobile we are as humans in the Melbourne environment. And there are two things. I mean, first, obviously, there is a relationship between when we reduce our mobility to try to combat COVID at that stage, it's peak COVID there, it is effective at mitigating the COVID cases. So we know that that exists, but also that there's a lot of noise in this signal, despite the fact that there haven't been any concurrent natural disasters here. There's been no other real external stimuli. And it's really that the rates of COVID and the patterns are modulated by cluster and spread dynamics and community controls. It's that we can't appeal to external stimuli to really have been the major factor here. The other thing, of course, is that the response from a government level has been science-led. It's been highly anticipatory and very precautionary. There are a lot of countries in the world that would look at our case rates and low fatalities as a real advantageous thing. But we were lucky as well. And just prior to the arrival of COVID-19 in Australia, we had really severe bushfires. And thousands of people, thousands of Australians were forced to evacuate to beaches and shared facilities, sharing water bottles and supplies, congregating in big masses. And had COVID arrived in Australia only a month or so earlier, this would have been a real issue. And so this is, in a sense, an example of a near miss. And there's several other examples worldwide where we actually predicted things could get very bad. This is an example from Texas, where we saw ascending COVID rates as we moved into the peak tornado hazard curve area. And we actually predicted that this would be quite substantial. But it turned out that 2021 in Texas, represented by the red line here, was one of the lower and certainly lower than average tornado rate years. And so there just wasn't so much of a tornado hazard as we might have anticipated. And of course, the other thing is that the signal was swamped by other variables. I mean, a lot of Texans, unfortunately, didn't want to wear masks. It was a real thing. And there were a lot of really complex dynamics in the system that related to those societal choices and so on. And
Sorry
the final
to jump
thing,
in, Mark, just so that we've got time for questions, if I could ask you to kind of finish up fairly soon, that would be much.
Yep, no problem. I've got 2 slides. Thank you. Sorry, I've talked a bit over. There are obviously societal perceptions that relate into this, the sort of that, I don't think that COVID has impacted on my ability to prepare for other hazards. I don't think it would affect my evacuation plans and so on, represented by this data here. And so just to conclude, the models that I show you are useful as crude forecasts of plausible COVID-19 scenarios. The PMs and more sophisticated agent-based models draw similar conclusions. And the timing and magnitude of external perturbations like hazards are we think, important, but we think that there are examples of, luck and so on that we just simply haven't had the events that could really have a massive impact. Risk amplification by other natural hazards is a thing. And there certainly is some evidence for natural disaster impacts on COVID. But we still think that the societal aspects, mobility and so on, are the biggest things. Pre-planning is key, and the other speakers have spoken to that. So thank you very much. Apologies if I went slightly over, but I really appreciate your attention.
Thanks, Mark, and virtual applause again. And really interesting to see how, I guess, a lot of geoscientists and earth scientists would have found themselves studying COVID this year. It's interesting to see how we can kind of contribute there. We've only got about 5 minutes for questions. I know that Evan needs to drop off the call at 10 a.m. UK time. So we'll go straight into questions, and do feel free to put any more in the chat. There was a really interesting one about sort of neglected disasters, so perhaps low magnitude, high frequency or everyday risk, or perhaps very rare events. How are they contributing to the aggravation of COVID-19? I think that's something that all 3 of you may be able to kind of comment on or give examples from your work.
Someone else go first. I just talked too much.
They definitely do have compounding impact, even if in normal times they might be on a scale as we see, where especially if they are very regularly recurring, and small scale governments and communities have found some way of coping in a lot of countries we work in. But of course, if you have the added complexity and vulnerability, added by COVID, or we also see this if you have displacement or other compounding factors, then even these small ones get problematic. That's why we are trying. I mean, even mentioned wind speed as a trigger for us, but we do try to have impact-based triggers. So really to overlay the forecast with vulnerability and exposure data. And as she mentioned, the Mozambique example, so that we can really trigger based on the expected impact. So if a small scale disaster because of underlying vulnerability would have a big impact, our system would still work. But to be honest, in this kind of scenario, we also see a big responsibility, not for anticipatory action only, but for disaster risk reduction, for mitigation, long-term mitigation, to really address this, because our humanitarian system is not for the very regular events. Governments and communities will have to find solutions, development agencies and so on, to reduce these risks long-term.
Thanks, Stephanie. And there was another question sort of related, so the idea of systemic risks often going unnoticed until they actually manifest into failures. And so what steps can we take to ensure their kind of early identification and early warning and action? Perhaps that's something Carol might want to reflect on, and maybe Mark.
Yeah, so maybe I'd like to talk from the perspective of how this anticipation work, the whole system work actually. So the purpose of this anticipation work is to anticipate any events, any disaster that might happen. And then we try to reduce the impact of that event. So I think while we are talking about the risks, in this whole system, we try to identify before it actually gets aggravated or it actually adds on to any events. So I think that's how it works. I'll not talk much, but it seems like it's already there in the whole approach of this anticipatory work.
Thanks, Carol.
Just a quick add on to that. I mean, I think our perspective from Timor-Leste and from other places is that there are things that can be done after prior disasters and before the next ones, sometimes rather simple things that can reduce the impacts of future disasters, and therefore put those thresholds of cascading, avalanche type behavior further back. So for example, maintaining urban streams and keeping as much rubbish out of them so that we don't go into full-on flood mode at the same level of precipitation, is just one simple example.
Maybe quickly adding on to that, I'd say that it's been interesting being part of a review with the Climate Center of different, I won't name names, but sort of an organization, and looking at their internal programming and how little climate risks are being taken into account. So this idea of simply making use of the projections and the knowledge that we have in order to, it is DRR, but kind of basic planning that then can really help address maybe not a lot in the wide scale, but in terms of some of the programming, and I think can be really significant and is pretty easy if you have access to those resources.
Thanks, Evan. It's really important to emphasize what we've already got. I see it's on the hour now, so I understand people may need to leave. But we've also got lots of questions. So I don't know who can stay on past the hour. You're welcome to stay, but so just in case people do need to drop off the call, I'd like to thank all three of our speakers and the Anticipation Hub for co-organising this event today, and we really appreciate the presentations and the questions. So virtual applause to everyone. If anyone needs to leave, please do go ahead, but if people are happy to stay on for a few minutes, there's a few questions coming through.